Bushra. I'm a fourth year medical student here at UT. And this project was done with my research partner, Grace Roberts, and our faculty mentors, Dr. Howard and Dr. Juma. So for our project, we looked at lead screening rates in pediatric patients. And lead screening is actually a really important part of pediatric well-child visits because the effects of lead poisoning can be very insidious and causes developmental delays that are not caught until later in life, where it's too late to perform these interventions. So the Tennessee Department of Health recommends lead screenings at 12 and 24 months of age. And then if patients have not had a lead screening at those times, they can get a catch-up screening up to 6 years of age. So we had a sample size of about 350 patients who consistently got care at this particular clinic. And we looked at whether or not lead screenings were performed at 12 and 24 months. And our main goal was to determine if patients were seen in clinic, what kind of barriers are we facing to getting these lead screenings completed. Some other things we assessed were the rates of catch-up screenings in these patients, as well as physician awareness of these recommendations and confidence in performing lead screenings. So looking first at figure 1, this just kind of looks at if lead screenings were performed at 12 and 24 months. So in general, the blue is patients who had a lead screening, late or not. And then the orange is patients who did not get a lead screening for various reasons. So at 12 months, we found that 47% of our patients, this dark blue here, were appropriately screened for lead at their well-child appointment. And then about 11% of patients, this light blue here, had lead screenings done at not at their 12-month appointment, but between 12 and 24 months. So just a little bit late. And then about 42% of our patients did not have lead screenings completed, and about 21% of that was the patients were not seen in clinic and therefore could not get their lead screening. And the other reasons for not getting lead screenings, about 10% had lead screenings ordered, but the lab in this clinic is a separate area of the clinic, so patients have to walk over there after their appointment to get their blood draw. So the screening was ordered, but the patient did not end up getting the lead screening. And then the other 10% was patients were seen in clinic, but the lead screening was not ordered. And looking at 24 months, we actually see that only about a quarter of our patients get lead screenings or got lead screenings at that time. And a large percentage of this were patients were just not seen in clinic and couldn't have a screening. And the other large percentage, about 33%, were patients did not have a lead screening ordered, and a much smaller percent here, about 3%, had lead screenings ordered but not completed. So we'll skip figure 2 for time, but just moving to figure 3, this observes the rates of catch-up screening. So if patients were eligible for a catch-up screening, did they get one up to 6 years of age? And about only 37% of our patients did get a catch-up lead screening. And moving to figure 4, we actually found that all 17 physicians who were surveyed gave us the correct times that lead screening should be completed, so 12 and 24 months. But about 82% of our physicians were either not confident or only mildly confident they remembered to perform these screenings. And so moving to our discussion and recommendations, obviously a large percent of our patients did not get lead screenings because they were not seen in the clinic for these visits. So that is a huge barrier and something we'd like to investigate for future studies, but not quite the focus of this one. So the two main barriers we found were lead screenings being ordered but not completed. So something that we recommended was a kind of checkout slip where patients would get this in the room with the provider, and they would write down if they needed to go to the lab, and if so, which labs they needed to get, just so physicians, patients, and the lab technicians were all on the same page. And patients would present this to the checkout desk so that they could confirm that they had gotten their lead screening, or if not, they could schedule a time to come back just for a lab appointment. So that was recently put into place about a year or two ago. And then the other barrier that we found was lead screenings not being ordered at the appropriate times. So at the time of the study, the clinic was using a next-gen EMR, and a few months after they switched to Epic. So when they made that switch, they added in a reminder at 12 and 24 months that would pop up on the screen that patients needed lead screenings. as well as reminders up to 6 months of age if patients did not have a lead screening on file at that clinic. So that was one of the big changes that we made. And we also suggested reminders in the nurses bubble and the physician workroom and in the patient rooms as well, to sort of have everyone aware of these Tennessee Department of Health recommendations, and just make everyone more aware of it. And so some limitations to the study were, of course, this is performed at one specific center, but I do think these recommendations can be extrapolated to other centers if needed. And it's a pretty easy study to perform at other centers. And then another limitation was just our physician survey was only 17 physicians just because of time limitations. So yeah, in the future, we'd like to go back to the clinic that with all these changes made and just kind of observe how the lead screening rates have changed, and hopefully they've improved, and see what other changes we can make. That's all I have. Thank you so much for listening.